Welcome to the Marvelous Middle Age Podcast, where we are building a community of people who are in the midst of midlife, sharing our stories and learning from each other along the way. Each week, I'll have a guest join me to discuss a topic that impacts our lives and touches on some aspect of midlife. We'll discuss relationships, transitions, health and well-being, parenting, careers, and more. My goal is to encourage and support you and help you thrive as you navigate this adventure of midlife. Join me here each week for the Marvelous Middle Age Podcast. In the second episode of the Let's Talk Menopause series, Dr. Teggatz and I talk about how to take care of yourself during the menopause transition. We discuss nutrition, movement, sleep, stress management, and more. It's especially important for us to focus on our well-being and health during this pivotal time in our lives so we can thrive for years to come. If you haven't already listened, be sure to check out the first episode of the series released last week. Dr. Teggatz and I provide an overview of perimenopause and menopause, including symptoms and what you can look forward to during the rest of the series. Dr. Tanya Teggatz, welcome back to the Marvelous Middle Age Podcast. We are in our second episode of this menopause series, and our first episode, if you haven't gone back and listened to that one yet, before you listen to this one, go listen to that. We talk about all things perimenopause, menopause. We talk about the definitions of those things, some symptoms, some symptoms you may know of, some that you don't. We talk about some ways to address these symptoms with lifestyle changes you can make. We do just kind of an overview, but this episode, we are going to dive a little bit deeper into that. So check out that episode. But again, Dr. Teggatz, can you just refresh us on the definition of perimenopause, menopause, and just share, kind of how someone knows if they're in that season,
Sure.
just generally.
So menopause is defined by having no periods for 12 months. And we can talk about, well, what if I had a hysterectomy? We can talk about that.
Because it's almost like a medically induced menopause, if you will, kind of thing.
So if you haven't had a hysterectomy or have an IUD, so no periods for 12 months. And perimenopause is the 7 to 10 years leading up to that.
Okay, great. And you had stated in the first episode that the average age of menopause in the United States for women is like 52. Mm-hmm. Okay. So if you're talking the 7 to 10 years before that, I mean, if you can even go into menopause earlier than that, you might be starting perimenopause in your 30s potentially. So,
and actually that's completely normal. So
very normal.
Average is 52, but normal's 45 to 55.
Wow. Okay.
For menopause.
Yeah.
And then So 35 is completely normal to begin perimenopause.
Okay. Gotcha. And I think that I just like to point that out because I talk to so many people who are younger than I am that are in their 30s, and they just think this is something they've got to look forward to later in life. And I'm like, well, no, not really. I mean, you could be starting in your 30s. So I like to make that distinction. So in this episode, we're going to discuss just a variety of ways to address the symptoms of perimenopause and menopause. Now, everybody experiences symptoms of different kinds to different degrees and severity. But I think a really important aspect of how to address symptoms is through lifestyle, which includes nutrition and supplementation and movement and sleep and stress management and other things that you can do for yourself to help you just feel your best. And I think a lot of these things are things that we probably all know about. We probably are doing some of them. Maybe we're not doing some of them. They're just basic good self-care practices. But I think when we're going through, we will spend, I think, a third, if you were privileged to age, right, as we go, we'll spend a third of our lives in this season. And so it's important to focus on our well-being and our health. And so let's talk today about some of these things. So I feel right now like eating protein is my full-time job. Can you share what we need to be doing with our nutrition in this season? What are those healthy habits we need to cultivate with our nutrition? And what should we be eating? What are some good recommendations for women in this stage of life for nutrition?
Okay, so let's dive in.
Yeah.
So for nutrition, I mean, just the basic stuff, whole foods, don't eat processed foods, plenty of vegetables. I recommend at least 5 servings a day, and half of a cup is a serving. So, when you think about it that way, that's not that
It's
many
really
vegetables.
not. It's really not.
You want to eat from the rainbow of colors for vegetables and fruit, I should also mention, but really probably 1 to 2 servings of fruit. Some people go overboard on fruit, and fruit does have carbohydrates in it, and a lot of people are pre-diabetic and need to watch that. So different colors of fruits and vegetables have different micronutrients, and hormones are chemicals in our body that need to be metabolized, and we need all the micronutrients from all the different colors in order to metabolize our hormones, and we also need them to metabolize toxins in the environment that we are exposed to. So another important aspect of this, having to do with nutrition is when you can try to eat clean food, as clean as possible. So again, if it's whole food, that helps. Organic where possible. And we're talking about, meat, dairy, or egg source. Try to get the, no
whole as
hormones,
possible.
Grass-fed beef if possible, organic, free-range eggs, all that kind of thing. It actually does matter because it has to do with your toxin load, and you really need to think about reducing your toxin load. So, healthy fats also are really important when we talk about nutrition. Focusing on protein, trying to get about 30 to 40 grams of protein, per meal. Kind of
that's a good way to think about it, because when I think about 100 to 150, it's like, oh, how am I going to do that? But if I can divide it up, that makes me feel a little better about that.
And trying to get some if you eat snacks, trying to get some in there. But meat, beans, eggs, a lot of people, and myself included, I use a protein powder. I find it hard to get enough protein without
like a smoothie
protein
or
powder.
Protein shake of some sort.
Actually, bone broth is another great one that you can get protein. 20 grams in a cup of bone broth. So
that's great.
That's another.
It's hard. It's hard. And I want listeners to know that, like, that's not, if you're like, oh my gosh, I'm nowhere close, just start to try to increase it a little bit. Start where you are. Try to increase these things as you're able to. If you're like, oh, I know I don't eat enough vegetables, just intentionally try to increase where you can, and you don't have to go extreme, like, oh my gosh, I'm going to get all this in, because you're just going to set yourself up for failure. You just have to
I'm kind of telling you, what the optimal is, and you start where you are. You can add one new thing, try one new vegetable every week.
And that's
see
a
where
great
you go.
idea. Then you don't feel the pressure, like, I can't do this.
This is optimal, but you start where you are, and you gradually you will get there if that's your goal. Yeah,
I love that. Let's talk about movement and exercise a little bit, because I keep hearing that lifting heavy weights is super important for women, for our bone health, and for so many other reasons. There is a doctor that I follow on Instagram, Dr. Vonda Wright, and she sees so many women who are frail and old that she can't even sometimes do the hip replacements or the shoulder surgeries on them, because they have just basically deteriorated away. Their bones and their muscles are just not
that is a huge
great. And frozen shoulder is actually a symptom. It can be a symptom of perimenopause. Is
very common symptom I see.
Your shoulder just stops functioning. So can you talk a little bit about movement and exercise? What can we do to help ourselves with this.
Absolutely.
It's
Well,
scary.
just to touch on what you said about lifting heavy weights, I mean, that is great if you can do it and you don't get injuries, but maintaining muscle strength in general, it is so much easier to maintain the strength you have in your 30s and 40s and even 50s than when you're a 70-year-old trying to gain muscle strength. That is so hard.
Yeah.
So maintain your muscle strength now, ladies. It's so much easier. And I mean, it can be fun. And yes, so heavy weights, that can kind of be the goal, but you start with what you can do now without injury. And there are so many free things online. You don't need a lot of equipment.
No.
You can use your body weight. You can use a resistance band. You can use objects that you have at home. And again, there's so much available online that you can do it, but you do need to exercise, or rather strength train all major muscle groups basically every other day, or 3-4 times a week to maintain or gain muscle strength, which is so important for bone strength. So, what I'm trying to prevent in my patients, and, as my patients age, what I, again, want to prevent is muscle loss and being that little old lady who, can't get up out of a chair, needs a wheelchair or a walker, which is what leads a lot of people into nursing homes. So that can be prevented through strength training. And actually, when we talk about hormone replacement, testosterone, it can really help with that. And then, so maintaining muscles, and then bones. You don't want to get osteoporosis. Fall, get a fracture.
That just leads down a road that's preventable. Hard.
But it takes work. It takes work now.
And women don't need to worry about. I hear a lot of women will say, "Well, I don't want to get bulky." You're not. I mean, everybody's composition is different, of course. But being, let's say you're on, testosterone hormone replacement therapy, and you lift weights, you're not going to bulk up. Our bodies, women's bodies, just aren't naturally designed to get super bulky. So I don't think you could if that's a goal. Yeah,
that's what you want. And actually, even if you're 70, I've seen some very strong, muscular older women, if that's what you want.
I love that. Yeah, that's fantastic.
Yeah,
but you don't. You're not going to get like bodybuilder big.
No. And then, of course, you have to do the cardio, daily, all throughout the day, avoiding being sedentary, 8 to 10,000 steps, plus getting your heart rate up. Again, you start with where you are and gradually work up to 150 minutes of getting your heart rate up per week, divided however you'd like.
I love that. Yeah, I've heard a lot of people that have found even just walking for like 10 minutes after a meal helps with their digestion. Like they'll just, maybe take the dog out and do like a 10-minute little walk or something. And if that's what you can do to start, then start with that and build up, And
it really helps with blood sugar. A lot of people are doing continuous glucose monitors to see what's happening with their blood sugar based on, what they eat. And one thing that I've found is known is avoiding sitting down right after a meal. I mean, even if you're just standing up and washing the dishes, cleaning up, don't go sit on the couch. But if you can go take a walk for 10 to 20 minutes, that, helps prevent prediabetes and diabetes and weight gain, and really helps blood sugar. So yes, walks after meals are, and they can be very, very slow, leisurely walks.
Right. You don't have to speed walk necessarily. Yeah. Unless you want to, of course. You can speed walk, but you don't have to. So let's talk about sleep a little bit, because I know for me personally, sleep is one of the areas that has definitely been affected for me these past several years. And I've talked to many women who are not sleeping great, whether they aren't able to go to sleep, they're waking up in the middle of the night and then not being able to go to sleep. What tips can you share with us to try to achieve a better quality of sleep?
Yeah. So I talked a little bit last time about a consistent bedtime routine. So that is super important. And I just want to touch briefly on just the importance of sleep. It's when our body rests and repairs, and we just don't function well. And as most people know, if you don't get good regular sleep, most most nights. So
Yeah.
just the importance can't be overestimated. If you don't sleep, you gain weight. It increases cortisol, and a lot of people don't understand that connection. So sometimes it's actually better to sleep in than to work out in the morning.
Right.
I'm not kidding. Because I mean, sleep is just very foundational.
That important. I was
So
listening to a
it
podcast the other
is.
day where these people were talking about it, and a guy said, well, what if I have to choose between getting enough sleep and getting my workout in the morning? And he's like, sleep, sleep,
Yes,
sleep
until
all the time.
yeah,
Yeah.
I mean, and then you prioritize and figure out how to
Right.
get the
You got to
workouts
get the
in.
workout in
But
still, but
really,
the
if
sleep
you're
would
not
be,
sleeping, I
yeah.
would probably prioritize sleep
Yeah.
over workouts.
Right.
Not to use it as an excuse.
No,
to
yeah,
not
I
work
was
out.
sleeping.
But
I couldn't work out. That's
yeah,
why I didn't do my workout
so
today.
the
Yeah.
importance of sleep. The other thing is understanding why you're not sleeping. So is it because of hormones? Either again in perimenopause, is it progesterone? Is it cortisol? So I frequently will check cortisol levels, and that can be a cause of not sleeping well, in which case things like meditation really helps that. And I'm talking about a regular practice, maybe 10 minutes a day, especially before sleep.
Right.
There are some great free apps that are out there that you can listen to before bed that
Yeah.
can help with sleep. Other things that can help. I mean, there are something called adaptogens, which are herbs that help normalize cortisol levels. Magnesium is the mineral that is the most deficient in the most people. It is involved in actually hundreds of biochemical reactions in the body, but one thing it does is it is calming. It helps you sleep. And magnesium glycinate or magnesium threonate are usually my go-tos. Taking like 500 milligrams of magnesium glycinate before bed can be helpful.
Okay.
There are many other, natural herbal sleep aids that can be used as well.
Right.
Even things like chamomile, lemon balm. But getting to the reason behind why you're not sleeping, is it worry, and dealing
It's
with
the
that? Is it
anxiety that can happen in
cortisol?
perimenopause.
Yes.
Yeah.
Is it low progesterone levels? I mean, I have to say, I've been just amazed by how well progesterone helps sleep. It's almost, it is rare when the cause is low progesterone that progesterone does not help sleep. In the perimenopausal, menopausal period, it helps women just sleep like a baby.
That's great. I love that. I think, and I know, and I'm sure everyone listening has had a time in their life when they just have not slept well, and the way that just impacts every facet of your life, from how well you're not eating or what you're able to do, work, family, relationships, just how you feel. If I have a couple nights where I don't sleep well, I almost feel like sick. Like it just makes you feel terrible. And it's such a key important thing. And I'm so glad that recently there's been so much research done on sleep, because I think for a long time people didn't take it into account, and now it's just one of those pivotal parts of our health.
Really is.
We really have to pay attention to that. And like you said, Tia, it was a great point, that get to the root cause of why. Right. You can, take things and try things and do things, but why am I not sleeping? Right. And measuring some things, some hormone things, some cortisol things, some other things, or even like you said, is it anxiety? Is it a racing mind? Is there something,
or maybe it's pain. So, we have your pain treated. Acupuncture, again, wonderful for sleep and pain. Sleep apnea is another thing, especially if you're overweight or obese. Please think about that. Do you snore? Do you wake up feeling tired? Do you have a morning headache? These are symptoms of sleep apnea, which means you stop breathing. You don't get enough oxygen when you sleep, which leads to heart and pulmonary disease. It's actually
deadly.
It's a medical condition that can be treated, and your sleep can improve. As well.
Yeah, I don't have sleep apnea, but I had a couple sleep studies, and I will have to say, if you even think you might have sleep apnea, or if your partner tells you, oh, you sound like you're gasping or choking in the night, go get a sleep test. And I will just tell you, if you've never had one, they are not hard at all. The people I've gone to the, is it the Eastern Iowa Sleep Clinic downtown? They are so nice. It's a really nice experience, all things considered. I mean, they hook you up to all these wires and things, but they make it as easy as possible. If that is something that you feel you need to do, talk to your healthcare provider about getting a referral for a sleep study, because they can tell so much, even just the time that you're there sleeping, about your sleep. And if you do need CPAP therapy, I know people that have had CPAPs that are like, I couldn't sleep without it now. I've adjusted. There's an adjustment period to having one, but once they get used to it, their sleep quality has improved and their health has improved, and they just can't do without it now. So it's not as uncommon as it used to be, I feel like. So next, let's talk about stress. Good old stress. Managing stress, I feel like, is critical at any stage of our lives. But I think, in the first episode, we were talking about this a little bit. Perimenopause is a time when sometimes our health kind of feels a little bit out of control. And at the same time, we're caring for maybe kids we have at home. We're in the throes of a busy career. We've got lots going on. We might be caring for aging parents. There's just a lot. And so therefore our stress levels, could be and maybe are higher than normal. What are some of your recommendations for people to help them manage stress during this time? I know that's a big topic, but anything kind of some go-tos.
First of all, stress is completely normal and we don't grow without stress. So stress is normal, but we were probably designed for short bursts of stress followed by some more normalcy, which is not what modern life, especially with technology, that's not what we're presented with every day. So stress is normal. It's how you manage your stress and how you react to stress. And I always try to counsel patients, the goal is to respond to your stress, which means you make a choice rather than react where you're just modeling behavior patterns and your conditioning, where you have no choice on what your response is to whatever you're presented with. So we do have choices, and it's all about how we prioritize and structure our lives. So trying to think about structuring your life in the healthiest way possible. I talked a little bit about relationships in the first episode, and just how important healthy relationships are, making sure you have people to lean on, and people that you care about, that you can serve as well.
I think even too, if you find yourself in a incredibly stressful time, if you seek out other resources like therapy or counseling, absolutely having your tribe of people that you can lean on is super important. And in addition to that, I think if you find a counselor that you align with, going to see them, because they're a kind of a neutral third party. And, sometimes it's nice to have that objective kind of input into your life, as opposed to it always being a family member or a friend, but someone who can just really objectively look at what you've got on your plate and help you navigate some of that, I think is really helpful. But I agree, because I think in the first episode, you talked about loneliness and how when we feel isolated, that really can contribute to a higher stress level. So to not isolate ourselves, find people you can talk to,
ask for help. It's a sign of strength to ask for help. And most of us think it's a sign of weakness, but it's really just the opposite. And probably those in your life would be happy to help you, and just remembering that. And there'll probably be a time in the future when you learn from a situation, then you'll be able to help someone else. So really just reaching out. And I think getting cortisol levels checked to see what the physiologic response on your body has been. If you have been exposed to chronic stress, and allowing yourself just time for self-care.
Yeah.
Again, as we age, we just have to be spending more time
Hmm.
with caring for ourselves
Right.
if we want to age well.
Well, yeah.
Um, then
Hmm.
things like, exercise is a good stress reliever. Again, meditation and prayer
Hmm.
is another great tool. There are herbs, like I said, that can be helpful
Can
as
help.
well. And actually
Hmm.
sleep.
Yeah.
Sleep helps stress. Unfortunately, when you're under stress, you usually sleep worse.
Right.
I often find people are either on a positive health cycle where one
Hmm.
thing, is positively affecting everything else,
Right.
or you're on a negative. So sometimes just making one positive change will then
Mm.
keep you on
Yeah.
a positive cycle towards
Right.
improved health rather
It's got
than
like a ripple effect
it
almost,
does.
you start
It
making some
does.
changes in one area and then you find that it starts really positively impacting other things, or because you see some, good outcomes, you're like, "Oh gosh, okay, I've been doing this and that's working.
Hmm.
Maybe I need to try this." And it just kind of, dominoes through
Yeah.
your life that way, I feel like. So, that's great.
And one other thing that I haven't touched on that I do like to talk about, and relationships, just
Mhm.
evaluating your relationships. And
Mm.
sometimes there are some toxic relationships in your life,
Yeah, for
identifying
sure.
those and sometimes eliminating
Right.
those if they are
Walking away.
relationships you have that control over. Sometimes it's
Right. You
family
can't.
members
Yeah.
that we can't
Right.
just
Or setting
eliminate,
some
but
healthy boundaries,
exactly,
having some non-negotiables, some
boundaries.
boundaries that, and again, easier said than done, I know, and don't, put a lot of pressure on yourself to do this, but having some boundaries with people that you feel might be contributing to your stress. And, even if you can just set one and try to practice that and hold to that,
Hmm.
that can start the process of you navigating that relationship
Yeah.
a little better, or maybe like you said, walking towards eliminating that relationship from your life altogether if that's what
Sometimes
needs to
we need
happen.
sometimes we need that, or yes, at
Hmm.
least setting boundaries where
Yeah.
if you're not getting what you need, or or the worst case scenario, they're actually harming you. That
Right. You
happens
need to.
more often than
Yeah,
we like to admit.
exactly. And then the stress that comes from all of that can just again have a negative ripple effect if you're not kind of keeping an eye on that. You talked again in the first episode about acupuncture. You've touched on it here. Share more about acupuncture. I know you practice it here in your
Yes.
clinic. Tell me more about that.
Okay, so I specifically do medical acupuncture, and what
Mm-hmm.
that means is it's acupuncture performed by a physician, either an MD or DO, meaning
Mm-hmm.
we have a certain mindset and training on how we
Mm-hmm.
think about the body. And acupuncture is very, very different from that. Chinese medicine is very different from that, but we
Mm-hmm.
take that perspective and we add what acupuncture has to offer to that. And
Mm-hmm.
so, you know, acupuncture is all about energy, and we
Mm-hmm.
have these channels of energy that run throughout our body that are measurable.
Mm-hmm.
And acupuncture with the use of needles placed at specific points, we just try to normalize the energy flow throughout your body, which
Mm-hmm.
allows the body to work optimally. That's really
Okay.
kind of the underlying
Great.
philosophy behind it. And there's,
Okay.
um, again, I was just at a conference, and it's amazing the research that has been done. The
Mm-hmm.
Some very good research, and um, acupuncture helps regulate neurotransmitters. It affects different pain chemicals in the body. I
Mm.
mean, it affects blood pressure and cortisol. And again, it is so safe
Mm-hmm.
and yet so effective,
Mm-hmm.
often very, very quickly. It's sort of like, why not? And
Right.
unfortunately, there
Try
aren't
it.
that
Mm-hmm.
many people that do it, but
Mm-hmm.
it's an incredibly safe and effective, and
Yeah.
often for things that, again, these psycho-emotional
Mm-hmm.
issues that
It's helpful
are
for them.
difficult
Yeah.
to manage.
Mm-hmm.
And it is definitely, worth a try.
Yeah,
And
why not,
most
right?
people, are amazed by the results.
That is great. That is great. And so if you've ever seen, so acupuncture, you're basically inserting a fine little, I don't want to
And
call it, it's
well,
like a
it's a needle
needle,
that's
but
about the width of a hair. I mean,
okay, so it's
it's
very
nothing
fine.
like
So it's not a
having your
painful
blood
thing at all.
drawn.
It's, yeah. Mm-hmm.
So yes, it's a very thin, sterile disposable needle.
Mm-hmm.
They are inserted at different places in
Place.
your body based
Okay.
on, the different issues that are going on,
Mm-hmm.
and, the techniques that the um, practitioner knows.
Right.
And it usually just takes a few minutes to put the needles in,
Mm-hmm.
after I talk with the patient to figure out what's going on.
Right.
And usually it's a very, pleasant experience.
Okay.
After I put the needles in, I try to make it kind of a spa-like environment. You're
Yeah.
laying on a heated table,
Mm.
and actually I use a mat that you're
Okay.
laying on that has infrared, which is a treatment in and of itself, and it's heated and it feels comfortable. And I turn off the lights and have the spa music playing, and
Oh,
you
yes. That
relax
sounds
for
great.
20 minutes. And again, most people look forward to it.
Mm-hmm.
And then we take the needles out, and usually you feel very relaxed afterwards. And that effect hopefully will last.
Right.
Typically an acupuncture schedule, for a
Mm-hmm.
new patient would be, weekly 2 or 3 times, then every other week, maybe a couple of times, and then gradually once a month or every
Okay.
6 weeks or so. Again, if it's a chronic condition, but
Right.
most people, look forward to their treatments. Now, I won't say that you don't feel any of the needles, because you definitely can, but it
Right.
shouldn't be a
It's
painful
not like you're
experience. If
getting
it is,
injections or something. Yeah.
no,
Mm-hmm.
no. Some of the needles you don't even feel. Some you do. If there's discomfort, it's very brief.
Wow. That just, yeah, the whole experience just sounds great, let alone the fact of the results that, and the
Right.
outcomes that you can have with it in not a very, long period of time. That sounds great.
Right.
That sounds great. So
Right.
another way that you can address
Mm-hmm.
symptoms of perimenopause and other things too, it sounds like. So
Yeah.
chronic pain or other types of things. That's great. Well, this has been wonderful. I think we all can take away, and I would tell people, if you pick one thing from each category that you could start with, like you said, start where you're at, pick one thing to work on in nutrition and exercise and stress and sleep. Don't overwhelm yourself, because
Right.
the last thing we all need is more stuff to do. But if there's simple changes you can make, it will just help your overall health. But I think especially during perimenopause and menopause, as you said, this is such an important time for us to
It is.
really focus on our self-care, our well-being, and our health. And we're worth spending that time and effort to do that. And through lots of other things, you can hopefully address some of the symptoms you might be having. Maybe they won't go away, but they'll at least be maybe less severe, or you'll just feel better overall. So you won't be
Mm-hmm.
experiencing, the symptoms, as severely. And everyone's different, right? So everybody has a different, kind of experience with all of this. Is there anything else you would just want people to know about things they can do for themselves during this season to take better care of themselves? Just general
Well,
things.
general things: sleep, exercise. Well, one thing we didn't touch on is there are some supplements
Yeah, talk about
that
supplementation a little bit. Yeah.
can help. And what I have found the most helpful is something called Estravera is the name brand, and it comes from, trying to remember, they have other brands available as well.
Okay.
It's not the yam. I am blanking on the plant source,
Okay.
but that has been very helpful.
But it's a natural, like a supplement you can take. Okay,
It
Estravera.
is.
Okay.
And another is black cohosh, which can help with hot flashes.
Okay.
but I just, Don Coy is another supplement that can help. But I just want to say, in my experience, the effects of supplements pale in comparison to actually replacing hormones.
Yeah.
But they are out there, and you can try them short of doing hormones. And they can be a bridge to help women during this time.
Right. Because everyone will choose to address these symptoms in different ways. And if you're someone who isn't interested in the hormone side of things, these might be things you could try to see what kind of results you would get. I have
seen them
help. Yeah, absolutely. That's great. Yeah. I know, a lot of people will start taking more vitamin D during this time. I think, where we live anyway in the Midwest, we're all kind of low in vitamin D. So, I mean, that could be at any point.
And I check everyone's vitamin D levels and pretty much
we're all low in it.
Yes, unless you're on a supplement
already. Yeah.
They're not in the optimal range.
Yeah.
So yes, vitamin D, often omega-3 levels are low, which the main source is cold water fish.
Yep.
So definitely eat more cold water fish, or you may need a supplement
to help with that. Exactly. Yeah. And and then would you also encourage people just to take a multivitamin as well, or would you rather target
diet?
Yeah.
I mean, if you eat the standard American diet, yes.
Yeah.
You probably need a good quality multivitamin.
Yeah.
But people who are really diligent about, eating their vegetables and their healthy fats and whole foods and all that don't necessarily need a multivitamin. Okay. I would say the average person could probably has some micronutrient deficiencies that could use a multivitamin.
Yeah, that's great. Well, it all plays in to just having a healthy lifestyle. It's so important, especially during this time with everything that we're going through, and all these things. Again, start where you're at. Pick some simple things to start with. It will have a ripple effect, is what I have personally found. And I will put links in the show notes to everything that you talked about today, so that people can look at resources and maybe try some things to help them. And if you want more information, come into the Teggatz Clinic and talk to Dr. Teggatz yourself and go through the process. And you can get some more targeted things to help you as well. So thank you so much for being on today. If you're enjoying the podcast, please follow the show to make sure the latest episode is on your podcast feed each week. I would greatly appreciate a rating and a 5-star review on the podcast platform you're listening on. It helps others to find the show. If there are topics you'd like me to discuss on the show, please email me at themarvelousmiddleagepodcast@gmail.com or direct message me on Instagram @Nicole Stute. Thank you for listening.